Hello, everyone. Good afternoon. If you're in Lagos, Nigeria, like I am, and if you're in some parts of the world, I would say good afternoon, good morning, good evening, depending on what time zone you are at. Welcome, everyone, to uh, Judge Index webinar. I think this is the third webinar for the year 2026, and I'm excited to be here. Can I see anyone in the comments? Any excitement to be here? I want to also know people who are joining this conversation. Where are you joining from? Would like to give some shout out very quickly to those that are joining us from all the different parts of the world. Can I see in the comments? Where are you joining us from today? Let's see. Let's see. I'm checking my comments. Any comments coming through? Okay, I haven't seen any. Kenya. Oh, Kenya. Thank you so much. I think that the Kenyans are leading actually in this conversation because every time we have a webinar, we always have representatives from Kenya. I think the last time we also had some representation from Uganda. Yeah, many people from Nigeria, but Kenya, good to see you. Thank you so much for joining. Um, who else? Where are we joining from? Let us know in the comments. I want to give a shout out to everyone, as many people as I can celebrate or give a shout out to. And whilst we're still doing our introductory greetings, can I please ask that you please help us share this link to as many of your friends as you can share to, because this conversation around quality management is not something that we gatekeep or something that we hide from people. It's something that we want to let everyone know because everyone has a responsibility when it comes to quality management. Thank you so much, those joining from Lagos. We see you. Thank you. Thank you so much. Okay, I will continue speaking and then I will come back to check the comments of those that are giving us a shout out from the different locations. We really appreciate you. Thank you so much for joining us today. We have a long conversation to be had today, so I'm just going to jump straight into it. Building a culture of quality, strategies for new hospitals. For those who are just meeting me for the very first time, and I'm sure it would be quite a number of people, my name is Nkiruka Okere, the lead partner here at Judge Index. And for the next while, we will be talking about something that is simple. It sounds simple, but in my mind, is actually one of the hardest things that any hospital will ever do, and that is building a genuine culture of quality. Building a genuine culture of quality. And so, if you are watching this video after this live session, I want to welcome you especially. Everything we cover here in this live session will be right here waiting for you. I'll flag some moments for you that I want you also to pause and think about as we have this engagement, as we have this conversation. And so you're welcome here if you're a medical professional that has practiced for a couple of years, a doctor, a nurse, a pharmacist, a laboratory technician. I welcome you. I welcome you if you are a founder or a hospital administrator. I welcome you. I welcome you if you are just opening a new facility. You've had this great idea for a long time about owning a hospital or a diagnostic center or any of the healthcare facilities, and you've opened one. I welcome you. Well done. If you're also trying to scale an existing healthcare facility, or you're simply just trying to raise the bar where you are, this session is for you. So I welcome every single one of you to this conversation. And I want you to try as much as possible to stay clear of distractions. This webinar promises to be engaging, it promises to be informative, but I really want you to be able to leave the session today with a couple of notes that you are going back to work on, with a couple of insights that you're going back to work on. As we always tell all our participants at any of our webinars, we don't just want you to attend a webinar and say, oh, that was a great webinar. No, we want you to attend the webinar and leave knowing that you have one, two, three, maybe four key next action points that you are going to start to implement or that you're going to start to do when you go back to your offices. And if you notice, we try to do our webinars on the weekend so that people have enough time to digest what they have heard and possibly on a Monday go back into work and start to talk about implementing some of these things that we have spoken about. So, welcome everyone, and I'm really excited to see you here. So, before we even got here, you know, today, we did something important for everyone who, or maybe for a lot of people who likely have gotten access to this link for the webinar who's joining us. You most likely would have seen that we asked you a couple of questions, right? We did that because it was important for us to know where you are and what your expectations are. We asked every single one of you that registered, and you told us two things. You told us, number one, what quality challenges you are wrestling with right now in your hospitals, in your healthcare facilities. And you also told us what you are hoping to walk away with. So I'm going to ask you to please look at the screen. Admin, please, can you move to the next slide very quickly? Very quickly. Just give me 1 second. Okay, let me see if I'm able to present that from here. Thank you. So if you look at the board and you look at the screen, you will see a couple of things that came in through as a recurrent theme in the conversation. So we asked a couple of questions. We asked the questions around what are your most common challenges, and you will see from the feedback we got from a lot of people, we're seeing things around building effective quality management systems, short staff strategies in the hospitals. We've seen things around weak structures in the organization. We've seen things around inventory management. Does any of that sound familiar to you? Does any of that sound familiar to you? Any of these challenges you see on the screen, does this sound familiar to you? If it does, just drop a yes in your chat. If you see your clinic or if you see your hospital having any of these challenges that you've seen on the board, just drop a yes on the chat. Just so that you know that you are not alone. You are not alone. The very same issues that you are dealing with or trying to solve for, many other people are also going through and trying to solve for these same issues. So you're not alone in this matter. Every challenge you've seen on this board is one that we've seen hospitals and healthcare facilities try to navigate, not just in Lagos, not just in Nigeria, in Africa as a whole. And so I want you to please keep your minds open about these challenges because we will talk about some of them in the course of this webinar to answer them adequately, right? So if you go to the next slide, based on what you told us, here is our promise today. I mean, for today, we promise that at the end of this session, you're going to walk away with something practical. You're going to walk away with something that is tangible, not just theory, not just some whipped up things cemented in your mind. You're going to walk away with something practical that you're going to be able to um, implement. Core ideas, core examples, core tools that you can literally start applying in your hospital from this week. And so, our commitment today is that you are going to walk away with key tools and items that you're going to start to engage with as as soon as today, as soon as you are willing to want to engage with them. We're going to cover building a culture. We're going to also talk about systems and structures. We're going to talk about patient outcomes. We're going to talk about leadership. We're going to speak on practical tools that would help you. We're also going to talk about accreditation readiness for some of the hospitals that want to delve into that angle. And we're going to also talk about how you can do all of this sustainably, because quality that bankrupts you is not quality, it's just a phase. So, as we move into this webinar proper, I want you to prepare your mind to take in and engage all that we will be talking about today. Next slide, please. So let me start this conversation with a quick story. I'll bring it to life with something real. Because when people hear stories, they think that it's something that is made up. No, this is not made up. This is a real story. Something that we actually walked into. When I say we as Judge Index. Um, a hospital, let's just call them Hospital X, right? They brought us in for a quality assessment on their newly built fertility center. They were about to start IVF services, if I remember correctly. And from the outside, everything about this hospital looked perfect. For confidentiality reasons, we can't give names, but it was perfect, sparkling clean, every single thing. Modern building, state of the art equipment, spotless walls, everything. But then we got in and started the engagement. We got underneath the surface. We realized that the rooms were not actually designed for how IVF workflows happen. We realized that the staff members had real gaps in medication management training. And I mean, you can't deliver effective IVF services if there's a problem in terms of your medication management and inventory. We went into um, the pharmacy. We saw that pharmacy storage was weak. None of this, I mean, none of these issues that we have mentioned was visible to someone who was walking through the front door. None. And so I want you to sit with that for a second. How many of you, I'm guessing that everyone here is a medical practitioner in one way or the other, but how many of you have walked through a facility, maybe your own, or maybe your friend's facility, or perhaps you weren't feeling great and you just went to a clinic and you entered into the facility and you thought, this looks great, without checking what's behind the workflows, without checking what's actually happening behind all these beautiful paintings we see on the wall, what's happening behind all these beautiful furnitures we see, what's happening behind all those beautiful, nicely dressed staff members that we see. I want you to allow that sit with you for a second, because this is happening right here, right now, that we are seeing a rise of beautiful hospitals being built with zero quality intentions behind every architecture. And that's the point of this whole session today. That's the point of this whole engagement. That quality is not something you see. Quality is not what you see. Quality is what is happening when no one is looking. Quality is what is consistently going on in your clinic, in your hospital, when nobody is watching. And the big question is, if it went to somebody else, would we have the same consistent result as we have seen when you were the one manning it? Quality is, it doesn't matter who's in charge. The same outputs that we have determined for this process, for this workflow, for this procedure, we will see it every single time we engage with this process. So it's not quality until we are able to get that level of reliability. So when you hear the word quality, what comes to mind? When you hear the word quality, what comes to mind? I want to ask again, this is going to be an interactive section, so I want you to please respond to me in the chat. I want to see your engagement on this. When you hear the word quality, what comes to mind? I'm looking through the comments. I'm still looking through the comments. I'm waiting for your feedback. When you hear the word quality, what comes to mind? I'll just read the comments as they come through. If you're watching, please go ahead and type in the chat. And if perhaps you are watching this video after this live webinar, I want you to pause the video at this point and actually answer that question for yourself. When you hear the word quality, what comes to mind first? And I want you to write it down if you're watching this video afterwards. If you sent me a word and you said, when you think about quality, you hear safety. I hear you. I hear you if you say the word safety. Okay, I see a comment here also, premium. Okay. Okay, thanks for that. Safety, premium. I hear someone say care. I also see someone say trust. If you use any of those words, I hear you. And I want you to stay with those words. Whatever word you choose, I want you to stay with it. Safety, trust, um, premium, consistency, care. I want you to stay with it for a second. Reliable, reliable. And the reason why I'm asking you to stay with it for a second is because quality, intentionality, thank you, intentionality. Quality, I mean, the truth about quality is that quality is not just a department. Quality is the culture of the entire hospital. Quality is the culture of the entire personnel in the place. So if you set safety, trust, care, reliability, intentionality, premium, I will agree with you, and I would touch on just a bit of those things in my subsequent conversations. So please let's go to the next slide very, very quickly. And I want to bring it back home to understanding quality from a WHO point of view. For the longest of times, I always like to look at quality from a point of view of this is what the world standard is, and this is what the world standard should look like whenever we want to talk about anything around quality. So If we look at the WHO standard or definition of quality, we would ground it very quickly in something that I would call an official definition, right? WHO defines healthcare quality quite simply, very simple. It is the degree to which healthcare services increases the likelihood of the outcome that you actually want, delivered safely, delivered effectively, and centered on the patient. I'll say it again. WHO, in their definition of quality, healthcare quality, or quality in healthcare, define very, very simply what quality means. They define it as the degree to which health services increases the likelihood of the outcomes that you actually want, delivered safely, delivered effectively, and centered on the patient. And so the four words I want you to hold on to with this WHO definition is safe, effective, patient centered, and standard based. Four words: safe, effective, patient centered, and standard based. If you want to touch on each of them, very quickly, for safe, you want to avoid anything that will cause injury or harm to the patient. Effective, you want to be sure that you're providing evidence based services, not this is how we used to do it, so let's just keep doing it. No, where's the evidence to support this practice? Three, you want to keep your focus on patient centeredness, i.e., you are responding to individuals based on the preferences that they have, based on the diagnosis that they have, based on their needs, and based on each individual's values. And the last one, standard based. You're offering care to a group of people or to patients that is consistent and consistently meets clinical benchmarks. Standard based. Now, I want you to hold on to these four things because we will come back to them very, very quickly as we move on to the next slide. Just hold on to those four words because we will come back and we will touch on them very quickly. WHO went on to further talk about the dimensions of healthcare quality, and they broke this down into seven dimensions. First of all, you had three essential dimensions that are critical to building a foundation for healthcare quality, and then you now have four supporting dimensions. Now, think about these three essential dimensions as your foundational building blocks. If you don't have these core three foundations, when you come to building quality, you haven't even started. So think about the three as your foundation and think about the four supporting dimensions as items that makes your foundation actually usable in real life, right? So we will go very quickly, next slide please, to the essential dimensions as WHO has highlighted in in the document. So let's zoom in a bit, right, to the first three dimensions. Effective care. Effective care here means care that is evidence based, not guesswork. I want to try and explain it in some ways, but I don't want to because we have many people from different countries here. I don't want to give an example that you probably won't understand, but let me give you an example in terms of what I mean in our climate. In our climate, many times we see that people say things like, "Oh, this is how we used to treat malaria. I've been a doctor for the last 15 years, and this is how we treat malaria." Sometimes you're saying to yourself, this is not how we know that malaria is being treated. So more than half the time you're asking yourself, what exactly is the right way to treat malaria? Is this knowledge going to be known for only a select few, or is it something that the entire hospital can utilize? And if they can utilize it, does it actually treat malaria? Or will you have a situation where a patient is in your hospital for countless numbers of weeks treating malaria? Effective care. It must be evidence based. It cannot be guesswork. It cannot be guesswork. And that's one of the very core foundations of healthcare quality. The second thing is safe care. Safe care. Can you please confirm you can see my slide? Let me know if you can see my slide. Just give me thumbs up if you can. Um, just give me a thumbs up if you can. Anyone? Yes, you can see. Oh, no, you can't. Okay, let me try this again. Please confirm now if you can see my slides. I just realized that it wasn't presenting. Okay, awesome. You can see it now. Awesome. Okay, cool. So the first one that I said was effective care, right? Meaning evidence based, right? Not based on guesswork, not based on someone saying, this is how I've always known to do this, right? The second foundation or dimension of healthcare quality that is critical to building any structure is safe care. And that is avoiding harm to your patient through reliable processes. Meaning, if I bring person A to do this process, it is reliable such that person B can do the same process and give me the same harm-free result. Safe care. The third foundation that makes up the third dimension critical in this foundation work of healthcare quality is people-centered care. Meaning, I, as a medical person, respecting the person in front of me, respecting their preferences, respecting their dignity. And together, these three define what patient focused care actually means in practice. Not just a poster you will keep in the lobby, not just something that you write somewhere and you say, oh no, we are a people that understand and do quality. Meanwhile, every other thing that you do has nothing, or no attribute to quality in it. The three foundations, again, if you remember, effective care, safe care, and people centered care. Now we'll move very quickly to the supporting dimensions, right? The supporting dimensions, which is very critical to as a building block on top of the foundation that you have already built. And I will argue, right, that these supporting dimensions are, in my opinion, the places where most new hospitals quietly fail. We have this great new building, we have this great new staff, we have these great people that have been recruited in this new place. But on these four supporting dimensions, we actually don't pay attention to it. The first one is timely care. The one question you want to ask when people walk into my facility, our healthcare center, our clinic, are they waiting too long between when they see a receptionist or see um, the person who opens a medical record for them. Let's assume they're first timers to your clinic. And when they see a doctor, an actual doctor, what is the waiting time? Are they waiting for too long? You need to ask that question. The second dimension is equitable care. Is everyone treated the same regardless of who they are or regardless of what they can pay? And I want you to sit with that second part very, very keenly, because if you if we're going to be honest with ourselves as healthcare professionals, right, we are slowly seeing a shift from healthcare seeking behaviors from a lot of people who we would call the low income or middle class in our hospitals compared to what it was before. Because now there's almost a body language in hospitals that is someone who is perceived to be richer than someone else. If that person steps into a healthcare facility, just by reason of how the healthcare professionals perceive that person will receive quicker, faster care than a low income earner. And please, I'm up for this conversation because it is something that has to be dealt with. It is a table, as they always say, that we need to shake and break. But it is happening in our clinics. It is happening in our hospitals. It is happening in our centers. And guess what's happening? A lot of people are moving systematically into traditional medicine because they just can't rely on healthcare professionals anymore. People are systematically moving into self medication in more ways, in more numbers than we have ever experienced it in our lifetime. People are moving into finding alternative means of dealing with their healthcare issues because they know, they have seen, and they have experienced it that there is no equitable care anymore in our healthcare facilities. And it's a critical supporting dimensions, so that if you have those three dimensions I mentioned earlier, effective care, safe care, and people-centered care, if you have it all built in your foundation, but you don't have equitable care, you will not be able to have the best when it comes to delivering quality to your people, to your clients, to your customers, to your patients. You won't. The next one is integrated care. Does the full spectrum of services actually talk to each other? I'm going to use a typical teaching hospital as an example. If you come to the average teaching hospital, I'm going to talk about the ones in Nigeria. My guests from Kenya and Uganda and other parts of Africa, I'd like you to please let me know in the comment section what it is like. But typically in some teaching hospitals or tertiary, you know, locations in Nigeria, where you have your accident and emergency and where you have the pharmacy, they are like, it's almost like 2 kilometers away from each other. So a patient relative who has just brought their relative to A&E would need to walk a mile to get to where the pharmacy is when they need to get any medications for their family members. Then, should we talk about the blood bank? You will need to walk further down to get to where the blood bank is. Should we then talk about the laboratory where you need to do tests? You can take a blood sample in A&E and walk 2 kilometers down to be able to drop a sample. Do your services speak to each other? Or is it disjointed? That patients always have to keep asking questions, and if there's nobody around to help them understand it, they can be lost in your facility. Is your process flow integrated such that patients know that from this point I move to that point, and from that point I move to this point, and they can all align how they receive care, integrated care. You also want to ask yourself, and that's the last dimension I'm going to talk about, efficient care. And when we speak about efficiency, we want to talk about things like waste. Are you eliminating waste as much as possible, or are you accepting it as normal? I remember someone wanted to give a an injection to a patient, and by the time we got into the room, they've used 3 syringes already. Why? The first time they were trying to bring it out, for some reason, it fell down. The second time they wanted to bring out the syringe, something happened. It was at the third time that we realized, just for an injection of less than 1 mil, we've wasted 2 syringes already. Do we accept waste as normal, or is it something that we are addressing critically? Those are the 4 supporting dimensions. And so when you're thinking about building a foundation of healthcare quality, you want to first tackle your foundation, and your foundations are effective care, safe care, and people-centered care. Then you want to build it on the you want to build the essential walls around this foundation, which is now your timely care, equitable care, integrated care, and efficient care. So, if we've understood this bit, what is then a culture of quality? When we say that a person, a clinic, a facility is talking about a culture of quality, what is then the culture of quality? If you ask me, I'm going to define the culture of quality, or what we mean by culture, because this is really the point where it gets real. A culture of quality rests on accountability, it rests on openness, it rests on teamwork, it rests on the patient focus, it rests on continuous improvement that is built on evidence. But if I have to give you one sentence to take home today in defining what a culture of quality is, it will be that quality is the safe, effective, and efficient way that we do things when nobody is watching. I'll say it again, that quality is the safe, effective, and efficient way that we do things when nobody is watching. Read that again. Not when the regulator is in the building, not when the CEO walks into the room, not when the auditor comes into your process area, when nobody is watching. That is the culture. I walked into a clinic before to do an audit. And by the time we got into the place, the first question we asked the doctor owns that process area. I think it was about a scan or so. And we asked, what is the process for this? What is the process flow for this procedure you're about to carry on? And the doctor said, oh, the quality manager should know about it. So I don't really put these things in my mind. I'm not really sure. I don't really know. And I was literally, my mouth was open. Like, the quality manager is not the custodian of quality culture. The quality culture is everyone's business, because everyone has a significant amount of contribution to what this culture actually looks like. If you get it right with your reception, you get it right with your nurses, get it right with your doctors, and you don't get it right with your pharmacy, there's a gap. If you get it right with your pharmacies, get it right with your doctors, and don't get it right with your nurses, there is a gap. If you get it right with all of your staff members and you don't get it right with your resources or equipment, there will be problems. There would be a gap. So everyone has a critical addition to the culture of quality. So I'll read it again. That culture is quality is the safe, effective, and efficient way that we do things when nobody is watching. Not when the regulator is in the building, not when the CEO is around or the GM, not when the auditor is around, when nobody is watching. That is quality. So I would talk about one common mistake that I've seen over and over again with hospitals, with clinics. We've seen that most people wait until something goes wrong before they start thinking about quality. We've had people at different times say to us, oh, there was an SAE in our clinic. And because of this SAE, we want to invite you to please come into our clinic and audit us. That's not the best time to bring in quality. I mean, they always say, the best, the time a person wakes up is their morning, right? That's great. But you don't have to wait until something goes wrong before you think about quality. You don't have to wait until something has severely gone wrong with a process, with a patient, with a resource, or with a staff, even before you think about quality. You see, that approach would actually cost you lives. It will cost you your license in some cases. It might even land you in court if you are not careful. I remember during COVID, we were invited by one of the prominent labs in Nigeria at the time because they kept on having a false positive result with their COVID testing. And they had troubleshooted a couple of times in different places and they were not sure what was wrong or what was going on wrong. And they had to invite us to say, please come and check. Now, at this point, they had to stop testing. They stopped testing for almost 3 weeks. Can I tell you the revenue that was lost in that 3 weeks where they stopped where they stopped testing? But it had to be done. And by the time we were done with the audit, we found out the issues that was wrong. Batching from a reagent that was used that nobody checked, that had expired, and blah blah blah. And by the time we reported it back, of course, there were consequences to it because all the previous tests that they had done from when that batch was received, they had to redo all of those tests on their own payment terms. Patient didn't have to pay again for those tests. They had to lose revenue for 3 weeks. Thankfully, nobody sued. Thankfully, nobody took them to court. But the revenue that they lost in 3 weeks was enough to pay everyone in that center salary for 4 months. The revenue that was lost in 3 weeks was enough to pay staff salaries for 4 months. And that's the mistake that we see happening over and over and over again. That people wait until something goes wrong before they talk about quality. People wait until something bad happens before quality comes in. Hospitals that build quality culture early, they always get better outcomes. And we've seen it across different hospitals, across different conversations. You will always get better outcomes. For those who pursue the route of accreditation, you will get better or faster accreditation. And those who have staff members that are engaged, you will always have higher staff morale. And of course, a stronger reputation. A stronger reputation. New hospitals, especially, you don't get a second chance at day one. Many times you don't. Sorry for that break. Hospitals who build from day one, especially, most times they always get it right if you build right. But those who don't get it right, many times you don't have a second chance to prove and to show that, oh, I really wanted to do right. I really wanted to do the best that I can in terms of quality. Many times you don't have a second chance at that. So if I have to recommend to anyone who's building from afresh or anyone who's scaling, I will always say build quality from the start. Build quality from day one. So let's get into building this foundation of a culture of quality. Like I said, quality is everyone's business, right? It's not just for the quality manager, it's not for the clinical lead in the hospital, it's not for the quality officer, it's not for the medical director. Quality is everyone's business, it's everyone's focus. So, concretely, what would you say are the key ingredients for quality? I will put them under four core principles. The first one is patient focus at the core of every decision that will need to be made. Patient focus. The second would be a leadership commitment. And every time I talk about leadership, I always take my mind back to the fact that you cannot move the needle when it comes to quality engagement if there's no leadership alignment to quality. Leadership commitment that sets the tone and models the behavior, not just signing off policies. Because again, if you are here and you are the medical director or you're a clinical lead at your hospital, or you are at a, well, high role or a higher role in your organization, quality, is not just about you signing off the policy. Is that you are living the very values that defines the policies you have signed. It is a greater responsibility for you as a leader to be committed to the things you have said that you are going to do, not just for the staff members, not just for the doctors or for the nurses, for everyone. Leadership sets the tone. And I always say, if you don't have a leadership team that understands quality and is invested in quality, you cannot have quality implemented in that place. You cannot. We've seen it many times where you have an enthusiastic head of quality, a fantastic quality manager, but leadership don't agree, don't align, don't believe in quality management. That great quality manager will suffer. It's not a curse. Leadership commitment is critical to the success of quality management in any place. Third foundation that I want to talk about is data driven decisions. You know, I feel that healthcare is the only sector or the only industry that amasses the kind of data that we receive and do let we analyzing, utilizing those data in many cases is less than 1%. We have such I'm passionate about data when it comes to healthcare because there's so many things that we can do, so many decisions that we can take just by the data that we have. If you even just look at your admissions data, for example, the people who have come into your hospital in the last, what, this is July, in the last 7 months, what's the top illness or what's the top reason that people have come into your hospital? Are you drawing conclusions from that top reason that you are seeing? Is the marketing and communications team driving campaigns around education on that? Are you sensitizing your patients on things to do to live better lives based on those illnesses? No, we don't. But you see, other sectors are utilizing their data like it is the air that they breathe. If you look at your admission rates, what is the average discharge time for the admissions that you have in your clinics? Can it be better? What was it last year? Are you weighing it against, okay, this is higher? People have been averaging 2 weeks. Why are they staying longer in hospital? What are the things that we need to start to look for and look out for to ensure that they are back home within the quickest possible time? We have data, but we're not utilizing it. We're not. Data-driven decisions. It's one of the key foundations to quality culture. And the next one is continuous improvement. Continuous improvement simply means, oh yeah, we scored a 10 today, but we are not settling. We are always raising the bar. There's always a better way to do things. And you see, when you are in a place that is focused on continuous improvement, you would understand that you are in a place that challenges you personally to be better, because everyone constantly wants to give the best care to their patient, give the best care to the next person who is coming, want to give the best experience to everyone who is there. Do you even know that for your staff members, when you are in a place where people are focused on giving their best, you have a certain level of fulfillment that your salaries can't give to you? You will have a level of fulfillment that cash can't give you. You can't justify it with cash. You can't. Continuous improvement is something that I am hoping that can be on the lips of everyone. Yes, we got it right this time. What can we do to make it better? Yes, we hit a waiting time of 20 minutes last month. What can we do to reduce waiting time to 10 minutes? How can we ensure that as soon as patients come in here, they don't have to wait 10 hours before we realize that we are giving them a wrong medication? What must we do to ensure that when customers or when patients come in here, every complaint they come into the hospital with is attended to, is dealt with? What can we do to continue to build trust with our patients? Continuous improvement will help you do that. And so if we put those foundations in our minds, how then do you build on a quality management system? What are the components that help you build this QMS system that we're talking about? The first one is SOPs. We spoke about standardized care earlier as part of the foundational dimensions that WHO spoke about. One of the key components of QMS, of the QMS system, is SOP. A real quality management has 5 moving parts. The first one is standard operating processes that would guide and standardize every process. I have been in a clinic before. Every single process, including when you come in through the gate of the hospital, the security men, how they greet you, how they open the door for you, how they dress, how they look, is in the SOP. Somebody will argue with me and say, oh, but the security man really does not have any implication in our healthcare. Let me just ask, since we are all here in the room, how many people enjoy going to the hospital? How many people? If you were not a healthcare staff, do you enjoy going to the hospital? Do you enjoy falling ill? Do you enjoy getting sick? Do you enjoy being rushed to the hospital for an emergency? No, you don't. The least thing that you want is that somebody at the gate is adding to the pressure that you feel when you are coming to a hospital. So, whilst for most people, it's not something that is considered most time, your experience from the gate of the hospital is critical. We've also seen situations where um, hospitals have been robbed. Patients who were on admission at a hospital got robbed because the security architecture in the hospital was not good enough. So you come to the hospital for one thing and you are crying about another thing. We've seen these things happen. So every single process in the entire hospital journey is critical. And for you to have a QMS system that is worth emulating, you must have standard operating procedures. Even if they are very simple and basic, it has to be documented. Let's be real. We know these things in our head. Sometimes we understand these things, but we need to document it because a quality management system is not dependent on one person and what they know. It's dependent on a system, a documented system. So SOPs, one of them. The second thing is performance audits. And people don't like audits because they feel like an audit is always going to oust them. But you see, that's why the culture of quality from day one is important. If you've been doing the right thing from day one, audits would almost look like, oh, come, let me give you a hug. Well done for what you are doing. That's what audits will look like. Audits will look like, another opportunity for me to improve on something that I'm doing. That's what audits will look like. Audits won't look like, oh, they're coming to castigate me, or they're coming to tell me that I'm wrong. No, they're coming to improve. They're coming to show that there's a better way I can do things, or I'm seeing based on based on the insight I have, that there's a better way to do things, that I can improve this by XYZ. Performance audits. If you are not used to it in your clinic or your hospital, I would recommend that it is something that you should open up yourself to get used to and to enjoy having them being done. The third one is staff training. Oh my goodness. We cannot talk about quality management systems and not emphasize on staff trainings. In the world that we are in now, we are seeing significant migration of healthcare staff and many other talents, right? When you're talking about quality management, you want to be sure that someone who's trained at Harvard and someone who's trained in, let me use another example, Anglo Ruskin University, that they have quote and unquote different school ratings, but they both land in your clinic and you want to deliver quality to your patients. Staff training means that there is an ongoing education to the commitment of quality culture that we have in line with our SOPs, such that even if you are coming from Harvard, you would be, onboarded on the on the quality culture of this center, of this hospital. When you do that, many times that your patients will never know which one is trained here or which one is trained there. Staff training is important. And that's why where you see performance audits, you see staff training, because every time there's an audit, even if there's no recommendation, there's always an opportunity to do something better. And once you review an SOP, it's an opportunity to train the staff members and all the stakeholders involved in that process on what this new process would be, so that everyone going forward begins to perform it with this new agreement or alignment that we have. In a couple of places where I have been invited to consult in healthcare, I always recommend make staff training a part of your engagement every week. If you do customer feedback, if you do clinical reviews or engagements, if you do nurses review or case note reviews or case reviews as nurses, you should have 1 hour every week where the entire staff is reviewing, is going through one education or the other, because it is important. The next component is risk management. Risk management is that framework that helps you to catch a problem before it becomes a tragedy. We always talk about near misses, incidents, and essays. And if you are a hospital that has a culture of risk management, you might never really record a severe adverse event, except there is something out of your control that happened. And when that issue is brought to the public, it will be clear that there was really not much that could be done here. If you are a clinic, a facility that emphasizes risk management as a critical part of what you do. So you are thinking about it. Every staff, every staff in every process area, through every procedure, has their risk management mind on. You won't need to remind someone to check if there's oxygen in the cylinder, because as a member of the team who's risk forward, I'm thinking, yes, I will have my SOPs and my checklist to help me. But that culture becomes something that is a part of me, that I'm thinking, because I don't want to have any emergency. Oh, yes, it's a low risk procedure. Nothing really should happen. But what if something happens? Am I fully equipped in this space, in this procedure room, to look after this patient if anything happens? That's how everyone needs to be thinking. And if everyone thinks that way, do you know that something might never really actually happen? But if it does happen, everyone, because everyone is thinking that way, everyone is prepared and ready to manage it. I've been in a hospital on for an audit, that the last time their healthcare professionals there did a training on CPR was almost 5 years before the time that I was invited in to do audits. And my question is, if you have someone who comes in, how do you know the right thing to do? Because you know what has been done, what you were taught 6 years ago. Medicine is changing. Life as we know it is changing. How do you know the right thing that is relevant for now to do to this patient? Risk management. We can't take it away from quality management. And the last part of it is feedback mechanisms. Every time we talk about feedback, we always talk about feedback from the point of patients giving us feedback. It's important that we get patients giving us feedback. Let me add the very critical element to it, because your first customers are your staff members. What are your staff members saying? What are they mentioning to you about the gaps? Are you actually listening to it? Are you actually taking the feedback that is coming to you? Or are you interpreting it as, these people are after my life and they don't care about all the efforts I've put in to make this clinic a great place? Is that what you're thinking about? Or you're actually paying attention? I want you to think about these key components of quality that I've mentioned and start to decide that you will do something about it going forward, because you need to pay attention to them and do something about it. Now, I'm going to rush very quickly through um, the next couple of slides, but we're going to be touching very quickly on some quality management tools. I'm just going to touch on them one after the other as we go on in the engagement. Let me start with the first one, which is risk cost analysis. Risk cost analysis in many situations. And let me just say that these tools they have been proven to work. They are not just tools that are being given to you to say, oh, just try this thing and see if it's going to work. No, they have been proven to work. And so it's important that you are not reinventing the wheel, especially because you are starting your new healthcare system or you are scaling one that is already existing. It's important that you're not reinventing the wheel. So root cause analysis is critical because they help you to find places where errors actually start. Not just what you are seeing, but where the errors actually start. And they're critical to find the root of any issues. That's one tool, and I always recommend this tool for anyone who is critical about finding or looking for the origin of a problem in their center. The second one is your PDCA cycle, your plan, do, check, act, which is one of the key tools that helps us to drive continuous improvement in what you're doing. Then you have Six Sigma that helps us to talk about, helps you to manage and reduce variation as much as possible, especially with your processes. And then you have what I would call the accreditation frameworks. And I always say, no matter how small your hospital is, try and see that you start up utilizing, even if it's as little as a framework or a checklist from any accreditation platform, whether it's JCI or ISO or SafeCare or NABH, anyone you want. Just try, because what it helps you do, it helps you start with excellence in mind. Because this framework sort of give you a benchmark that you should aim for. And we're going to try and unpack a few of these tools in a moment. But first, let's talk about the foundations that have to be in place before any of these tools work. So, in my previous conversation, you remember that I told you about leadership commitment. And I'll say it as plainly as I can. No quality culture survives on poor leadership. None. I have never seen it happen before. It does not matter how good your SOPs are. It does not matter how great your procedures are. It does not matter how fantastic your staff is. If leadership is not setting the vision, modeling the behavior for all to see, allocating real resources to areas that you need resources to, and actually monitoring the outcomes that you want to see, then we have not started. Leadership is not a memo. Leadership is not in the signing of documents. Leadership is in practice. So if you're a leader here, please, I want you to leave this session, this conversation, with a resolved commitment, with a resolution in your mind that you are going to be committed to building a culture of quality in your clinic, in your facility. If you are a head of department, if you are a clinical lead for governance, if you are a doctor, and let me also say that you don't have to have a title to carry this leadership commitment. It starts from you, one person deciding that I will do this right. I will do things right. It starts from you. But if you're a leader here on this call or watching, please build the commitment to ensure that everything when it comes to quality is delivered right. From vision to the behavior you will model to resources allocation, every single thing must speak to that culture of quality. The second one is patient-centered care. You are making a commitment to yourself that you cannot place any other person apart from the patient at the heart of every decision that you are making, meaning that the experience of your patient, it matters, not just their diagnosis. Every autonomy that patients need to have, their choice, everything, it has to be done and carried through the heart of the patient, or has to be done with the patient at the focus of the engagement. It's it's not just thinking about their diagnosis and generalizing them. No. Real autonomy and choice should not just be a signature that is rushed through. Oh, but I informed them. Oh, I told them. Oh, they should know. I've heard a doctor say something to me. Oh, but the patient should know what the side effect is of this. No, that's why they're not doctors. It is your responsibility to help them make informed decision by the knowledge that you share with them and by the information you give to them. And that's you respecting patients. Dignity in how they are treated, dignity in the communication you give to them, honest, compassionate communication, and confidential too, in many ways, because somehow we've gotten comfortable with breaching confidentiality, all in the name of, oh, I don't want things to go south. That's why I'm mentioning. I don't want things to go this way. That's why I'm saying this. Confidentiality is quite critical to engagement when it comes to patients, and we know this, right? C, staff recruitment. Now, and I think that this one is always almost underrated. This foundation around staff recruitment, who you hire in the first place determines everything. Your culture, it starts at recruitment. I joined a clinic a couple of years ago, and I had two offers at the time that the clinic approached me. But I went with that clinic because nothing told me about we speak care as a language in this place than my recruitment process. In my recruitment, one of my I think it was the exams or the test that I was supposed to come in to write, I wasn't feeling well. So I told HR, I said, oh, I'm sorry, I cannot come in for this test because I'm unwell. It was a hospital I was coming to work in. And the HR says to me, oh, I'm sorry about how you feel. We will see how we can reschedule this session for you. I mean, great. That's fine. Fantastic. I was fine with that. Do you know what happened the next day? HR called me to just check in. I'm just putting a call in to check in and see how you are doing. Are you better today? Are you feeling okay? Don't worry, please take your time and get well. When you do get well, we will fix another time for you to come in and write the test. Joe, I wanted to get well like the next second because I've never experienced anything like that before. That someone who's you've not even given me the job. I'm still in the interview process, but you cared that much about me. That HR called me, and trust me, I wasn't the only staff that was being interviewed. We were 20 when I came in to write my test. But nothing screamed, we have a culture of care like that process. And when I came into the clinic, oh, I knew that I made the best decision to work here. And it's changed everything about me. Staff recruitment, your culture of quality, it starts from recruitment. You're looking for competence. You want to verify the skills, you want to verify clinical knowledge. You should also be looking for integrity, honesty, accountability. You should be looking out for compassion. We've seen people that have said things like, oh, he's a great doctor. He just doesn't know how to be. He's not compassionate. He's not. I'm sorry. It doesn't work like that. Your patient cannot interpret you as a wicked doctor and you are insisting, no, but I'm the best doctor that there is in this place. Take it or leave it. You will not do so well. I'm sorry. And patients, they will go out and spread the news. That doctor is a very wicked person. That doctor is not a kind person. It's not a good person. Meanwhile, you are competent. You've got all the clinical knowledge that there is to make them better. But they can't build trust with you because you don't have empathy. Not performance, genuine empathy. And then teamwork. Oh, teamwork is critical. You can't talk about a commitment to quality when there's no shared engagement with a team. We don't want a quality management system that is built on one star player. Ah, this person, this person in this department knows everything about quality. No, you can't build a team of quality around that, around just one individual brilliance. It has to be built around a team, about around the collaborative effort that speaks towards quality. And that is very, very important. The next foundation is staff orientation. Every single new employee that you get into your business needs a proper orientation, not a half day tour. This is that. They need proper orientation, real onboarding that covers your mission, covers your vision, covers your quality policy, covers your infection control or prevention policies, covers your documentation standards, everything that makes you who you are. Your new employees need to know that. They need to take it on. What you are showing or demonstrating is that you are building a real quality, ready workforce from day one. And if you're not showing your new employees that, you are not even building at all. So a new staff should come from day one and say, oh, my onboarding today was fantastic. I learned about this. I learned because everyone need to see themselves as a part of what you are building. Every staff that you bring into your business has to see themselves as a part of this great thing that you are building. If not, they're only there to just while away time and just pass time. And when they are done, they move on to the next big thing or the next great thing in their lives. The next foundation is your SOPs, and I've mentioned this before. Here's one phrase I want you to remember: no hospital should depend on memory. No clinic or facility should depend on memory. Your SOP is your backbone of safe, consistent care. It should not be dependent on memory. Your admissions, emergencies, your laboratory, your pharmacy, your surgeries, your infection control, your waste disposals, your referrals, all of these things constitute the the synergy of care to give to your patient. If it is not written down and it is not trained on, it is not a system, it is hope. And no hospital, we have seen this over and over again, no hospital can grow or scale on hope. None. The next foundation is your policies and procedures. There has to be clear policies that protect both the patients and staff. And it has to be clear for all to see. Medication and consent policies, it has to be clear. Hand hygiene, I mean, still the single frontline defense against hospital acquired infection. It has to be clear. Your patient ID and incident reporting, it has to be clear so that errors are caught and documented transparently. There has to be a complaint management policy or procedure so that patient feedback actually drives improvement instead of getting buried. Because every time patient gives you a feedback on something that you have done, it's an opportunity for you to do something better if you take that feedback critically. And I'm going to keep this conversation on this last bit: continuous staff training. It never stops. We talk about Kaizen earlier, continuous improvement. It never stops. Training never stops. Clinical updates never stops. Your CPR certification and BLS certification, it never stops. Infection control never stops. I mean, we just got out of COVID a couple of weeks ago or months ago. We're hearing about the Hanta virus. It's always one new thing that's coming up. Healthcare is a service. You want to talk about customer service training. Patients are asking for more. You want to talk about communication skills training for your staff. You want to talk about documentation standards and training. Competence is not a one-time achievement. It is maintained. And if you don't maintain it, it will decay. If you don't maintain these systems, it will decay. And so building a system that works in quality, that supports in quality, they don't work in isolation. They need to function, all of these systems need to function as an integrated network, from your clinical governance and your risk management to your clinical audits to your patient feedback to your KPIs to your incident reporting to your corrective actions. When you have these incidents being reported, everything needs to work together synergetically. And when these all link together, you get a hospital that actually learns and grows. You get a hospital that actually improves and gets better instead of one that keeps repeating the same mistake all the time. And that's where we must strive to get to. I spoke earlier about the PDCA cycle. I like this PDCA cycle a lot because it's one of the tools that helps you bed down. In some clinics, we've seen people who are talkers. They will talk about all the things that needs to be done, but they don't know how to execute. What this tool helps you to do is that it helps you to bed down every execution as something that needs to get done. So you write out your plan. And after you are done aligning with your plan, identify the problem, find the root cause, or you set your clear objectives. You then go into the next phase, which is do. You test your change on a small scale first, and then you now expose it to the bigger change that you want to see. And then you check. Many times people stop at do. Oh, patient gave feedback that we should hang a water bottle above the door whenever they come in so they can feel cool. You hang it. That's all. I've taken feedback from my patient. But when you check, what checking does is that it helps you. Can we get the slides? Yes, I'm sure our team will be able to help you share the slides so that you can engage with them afterwards. Thank you for asking. Okay. When you check, you are actually confirming what I have done compared to what I planned to do. Am I still getting the same objective that I wanted? Am I still aligning on the same results that my target was? Check. And any system where you're not evaluating, oh, you'll find out that you have gone on a different tangent from what you are set out to do because things change. So PDCA is important. Your A is standardizing what has worked, what you need to go back to do better, or what you need to revise, or what you need to emphasize on to continue to do more. PDCA. That's the first tool that you want to check and you want to see. The next tool is your fishbone diagram. And most people don't talk about this a lot because some people have said, oh, this tool is very confusing for me. I don't know how to engage with it. Some people call it the Ishikawa diagram. You know, say you have a problem, a patient fell on a ward or on admission. Instead of guessing at one cause as to why the patient fell, you can map out every possible contributor or every possible reason across people, process, environment, equipment, and policy that can give you a likely indication as to how and why did this patient fall. It forces you to look at the broader, bigger issue or perspective other than someone made a mistake. Because you see, in healthcare, we're very quick to look for who is the person to blame, who is the person we're going to hold responsible for this. The fishbone diagram helps you to look at things on a broader perspective, not just who made the mistake. You want to look at the people, you want to look at the process, you want to look at the environment. Was there water around leaking from an AC that you didn't know? And so the patient slipped and fall. Was the person with the patient competent enough to carry out a procedure of moving the patient from one point to the other? You want to ask all those questions so you can get a bigger view as to why the incident happened. The next tool that I love, and I've used this many times outside of a hospital or outside of healthcare, is the five whys. And if you listen to children a lot, when you ask a child something, or when a child, or you tell a child something, they tend to ask you this, the five whys. It is very simple, but very powerful. When you state the problem, you ask why five times. Each answer you get becomes the next question until you get past the symptom and reach the actual cause. And then you can now build a countermeasure that prevents it from happening again, not just a cover up on it. So, patient fell. Why? Patient left the bed unaided. Why? There was no nurse on duty. Why? Nurses have been short staffed. Why? Not one nurse I was supposed to replace had to go and have her baby and nobody could replace. Why? By the time you ask your wife five times, you get to the actual root cause that you need to be dealing with. Because if you don't ask the five why, patient fell. Who was on duty? We have to penalize this person. We have to make sure you not even addressed why this issue happened. Or a medication error, for example. Why did this happen? And you ask your questions across the different responses that you get until you find the answer that you're looking for. And I always implore everyone, use the five why. It's very simple, but it is powerful. Use it. The next tool that I always recommend is the SWOT analysis. And if you're a person of strategy, you would understand why this is so beautiful to see. The fourth tool talks about your SWOT, your strength, your weakness, your opportunities, and your threats. If you look at your strength, you can see things like, oh, I have skilled staff that are competent. I've got strong leadership. I've got the latest equipment. If you look at your weaknesses, you can identify things like staff shortages at different times in the week. You can look at poor documentation in my hospital. You can look at resistance to change. When you then look at opportunities, you will see, oh, there are new frameworks or accreditation pathways that I can explore and get better. Oh, there's this digital health opportunity that I can plug into and serve people a lot more better. There's partnerships that's happening I can tap into. And then there's funding. And then when you look at your threats, things that you cannot control, your regulatory shifts, things are always changing in the regulatory space. You look at rising expectation, you look at competition, you look at talent migration. This one, you cannot even control it because, before we used to think that those from Africa are just leaving Africa and going to UK and the US. Now we are seeing a lot of UK, US based staff, healthcare staff migrating to Canada. And now we are seeing a lot of healthcare staff members in Canada migrating to Dubai. And you're wondering what is going on. So, your SWOT analysis is always a very important tool to also help you in managing, deciding, and engaging with quality. Now, I just want to touch a bit on technology and quality improvement because you can't talk about quality improvement in 2026 and you don't highlight the importance of tech in it. Digital tools, as we see it and as we know it, are genuinely transforming how hospitals deliver, monitor, and improve quality. From your electronic records to your AI driven analytics, I talk about data driven decision making, to your technology that your patients engage with, everything empowers number one, your staff members to reduce errors and also put data driven decisions in the hands of every level of the organization. It won't just sit with a CMD or an MD, for example. Every leader, every subunit lead can see data that they can use and make a call or make a decision about a, a patient. And I'll just slide quickly through some of the technologies that we have existing in this day and age. Most of you have heard about the EHRs already, and some hospitals are already using them. Now, some are opposed to change, and some are saying, just leave me with my paper and my biro to write these things the way that it is. But we are seeing that for better care coordination across departments, EHRs are important. And we've seen data that has actually shown a 25% reduction in medication error through digital order validation. We've seen data that supports that this is where the world is moving to. So we need to get into the things of using technology to be able to drive health records for patients. We've also seen a lot of conversations around CPOEs. And CPOEs, if you ask me, are the next big thing that people need to talk about and people need to engage themselves in, where there is that computerized provider order entry that everyone gets used to, everyone engages with. Clinicians can enter the medications and treatment orders themselves electronically without anybody overstating things or understating things. And that is the future of things and where we need to get to. I've When you get the slides, you will see information, things like the HIE. You also see things around telemedicine and digital tools that everybody is now used to or aware of. But I want to quickly land on the common challenges for new. Can everyone hear me now? Technology is great. Technology is great when it behaves itself. Please confirm you can hear me. Okay, fantastic. Sorry about that break in transmission. So I was talking about the common challenges for new hospitals, and I'm just going to sort of land my conversation here because we see it all the time. Let's be honest, we have different issues that faces new hospitals. We look at things or barriers around limited funding. And when we even asked the questions earlier before the before the webinar started, it was something that some people have said to us that we have a funding issue. We are limited in terms of our funding. We have an issue when it comes to funding and managing funding in our hospitals. It's a real issue and it's a real challenge that we have to be honest about. We also see that there's the real issue or challenge around staff shortages. We see it. We also see challenges around weak leadership. Some people just know that the owner of this hospital or this clinic has a lot of money, opened the hospital, but is not ready to drive any kind of leadership alignment to what they are doing. We see it a lot. And we've seen things around poor documentation and regulatory compliance gaps. None of these issues are unique to you. Every hospital that I have seen has gone through one or a combination of these things on the list. The difference between the ones that thrive and the ones that don't is that they name these challenges early and they deal with it. And the ones that don't thrive, they pretend that these challenges don't exist. But I know that you are not one of them. So we're going to do things better. I'll leave this case study on here for us to digest for just a second. And it's a very difficult one because again, this is not theoretically made. This is a real story. It's a difficult thing to think about and it matters maybe a lot more than the slides I've shared before. A 21-month-old child died following a routine procedure. Why? Inadequate post sedation monitoring. No nurse assigned to observe the child during recovery because someone thought that someone was looking after the child, and someone thought that another person was looking after the child. And by the time you checked, nobody was actually tasked with the responsibility of looking after that child. Vital signs were not documented, no emergency protocol activated. Let that sink in for a bit because that 21-month-old child could have been anyone's child. And it's more painful because this entire process, this entire issue or event could have been preventable, could have been prevented. And I want you to hear this clearly, right? It happened because a system failed, not because one person was careless. No, no, no. It happened because a system failed. And that distinction, it matters enormously. It matters critically because it tells you where you need to actually put your energy in, not in blaming individuals, but in building systems that don't depend on any one person to get things right. It depends on the system to force people to do things right every single time. Every single time. And so, if you think about what a core lesson is from that case study, the question we should always ask after something goes wrong is not who messed up. The question that we should always ask is what system failed and how do we prevent this from happening again? What system do we need to put in place to make sure this doesn't happen again? Your SOPs, your staff competence check, real-time monitoring, thorough documentation for every process, regular clinical audits, visible leadership commitment. These are systems that actually save lives. It's not a slogan. It's not an ad you just put somewhere. No, 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 no. These are systems that save lives every single time. Every single time. And so, as we race to a close, Nkiruka, I've heard you for the last, 1 hour plus, speaking about quality. What do I need to do? How do I need to build this quality to get there? And we've outlined it in about 8 steps. We'll take them in a couple of cohorts and then we'll run through it. Roadmaps 1 to 4, and I'm highlighting them, just as we have seen this thing. I'm summarizing it into eight roadmaps because I feel like it's the maybe easiest way that we can grasp a lot of these things. But let's look at roadmap 1 to 4. The first 4 steps lays the groundwork for what needs to be done. Please build your vision. Define what your vision is for your clinic, for your lab, for your healthcare facility. Build your vision. Then build your quality policy. What is the thing that you want to, what is that hill that you want to die on when it comes to how you want your patients to be looked after? What is the commitment that you are giving to your patients, to your staff, to the environment where you're carrying out your operations? What is the quality policy that you're communicating to them at every time? You want to highlight that, not just a signature, not just a poster on the wall. Then you want to also develop your policies, your SOPs. You want to put it in such a way that your policy and your SOPs are not just something you copy and paste from somewhere. It has to be real. It has to be brought to life with what you do in your clinic. Then you want to recruit competent staff. You want to recruit competent staff because, like we said earlier, your culture of quality, it starts at hiring. It doesn't just start at when something goes wrong or when you start doing your training. It starts as your hiring. So going through roadmap again, 1 to 4, define your vision and your quality policy, secure leadership commitment, develop your policies and SOPs, and then number 4, recruit competent staff. Now I highlighted some parts there, develop policies and SOPs, because some people have said, oh, we don't know how to develop policies and SOPs. Judge Index is here to help you do that. Oh, we don't know about recruiting competent staff. One of the core services that we have seen that is important in the market where we operate is that some people want to hire quality managers into their businesses to look after stuff. But you just get any random person and say, oh, I'm giving you this role of quality. So, what we are offering to hospitals and clinics is that if you want us to help you recruit a quality manager, we will. But we also want to be able to train them. So when they are coming to you, they're coming to you fully trained to be able to carry out every quality service and engagement that you need. So if you are stuck in steps 3 and 4, please know that Judge Index is here to help you out with them. So let's go to roadmap 5 to 8. The final 4 steps really embed your quality into your daily operations. There has to be orientation and onboarding for every new hire, and this is a non-negotiable. We have also been called a number of times to say, oh, Judge Index, we've hired new nurses. We want you to come and give our nurses trainings around customer service, trainings around confidentiality, trainings around how to deliver best care to patients. And we've come in to deliver those trainings to nurses or to any staff members that you want. So we are also available to do that. We are also available to do continuous training that never stops on when I say any issue that borders around healthcare. Because some people say it's too much for me to think about. I'm making all these plans, then I'm not still thinking about the training, then I'm not still the one doing the training. Don't worry, we've got you. Just let us know what areas you need help in. We will come in and we will do the trainings for you. The seventh step is measuring your quality KPIs through audits and KPIs, measuring quality through KPIs and audits. And that's one thing that most people know us for at Judge Index. With our quality audits, that's helping a lot of hospitals see gaps in what they think that they were doing and what they should be doing, and helping them bridge that gap to be able to deliver better care to um, to customers and to patients. And it is something that if you need help with, we are also here to assist you to carry that out. And the last thing is your continuous improvement, applying your PDCA cycles and all the corrective actions to be able to sustain quality growth. 8 roadmaps, 8 critical roadmaps. Now, if you ask me, what are your key takeaways or what should I leave this session with? I will leave you with these key items, 6 of them. The number one, quality starts with leadership. Quality starts with leadership. Number two, every staff member owns quality. Quality is not just the business of the head of quality or the clinical lead or the matron of the hospital or the chief pharmacist. Every single staff owns quality. Number three, your patients define quality. If you say, I've been giving you quality care, I've been giving you quality care, and your patients are still not satisfied, they have poor outcomes, then you have not delivered quality. Four, your systems any day, anytime will outperform individuals because systems will force individuals to a certain way of life that you have defined, that the organization has defined. And then number five, quality is a journey. It is not a destination, meaning continuous improvement is something that would have to be at the backbone of what you do, of who you are. Continuous improvement is essential. And you cannot say that you have attained Kaizen fully without continuous improvement at the back of your mind. I will leave you with these key takeaways and I would throw questions out to the open. Do you have any questions? What has stuck with you more or the most in this entire time that we have navigated through this webinar, Building a Culture of Quality? Any questions? Okay, I see a comment here. How can I get your training brochures? Please, can you drop your email to us and a member of the team will reach out to you so that we can send you a training brochure that is tailored to what you want or tailored to what you desire in your space. Please drop your email, or if you want to reach out to us, we're more than happy for you to please do that. Can I please ask admin to please put our emails in the chat so that those who need the training brochures can please reach out to us, or if you're more than happy to drop your email, then we will send you the training brochures. Thank you so much for that question. Any other questions? Any other question? I'm here. I'm here for us to engage. Any other questions? And if you're watching this later and have a question for us, please reach out directly. Um, Reach out to us at judgeindexinc@gmail.com. If you're watching this video at a later time and you get to this point and you have any question for us, please reach out to us directly at judgeindexinc@gmail.com and we'll be more than happy to take your questions. Okay? If there are no questions, I will assume that I have been a fantastic presenter and everybody understood everything that I said and everyone, is fully happy and well equipped as to how to go on to build the quality framework for their hospitals and their healthcare centers. If you do have any questions again, please don't forget to reach out to us. One of the things that we've also done is that we've gone ahead to create free resources for you. For some people, they keep asking questions around, oh, how do we engage? How do we even start this whole thing? My hospital is a very small hospital. We have a free resource for you, a free guide for you on audit checklists that you can work with. If you already have a quality manager in your business, please look at the link in the chat and click on the seller link and it will take you directly to the free resource, the free audit checklist that you can use and even just start the conversation from Monday. Implement it and give it to your quality manager and ask them, please use this audit checklist and let's start to engage with what we have. How can we make things better? Use that tool as your first landing page to start the conversation around quality. So, if there are no other questions, I want to say thank you so much. Thank you for your time, for everyone that has stayed with us for this almost 2 hour webinar. Thank you so much. Thank you for your engagement and thank you for your questions. And thank you for joining us from everyone who's joining from around the world. We appreciate you. For any further inquiries, please don't forget to reach out to us in our emails, our website. We also have a phone number there. If you want to reach out to us via our phone number, please, more than happy to do that. We're also live on Instagram and Facebook. You can find us on at Judge Index INC on Instagram. We'll be more than happy to take your comments. And just before you leave, we want to get your feedback. What are the um, things that we've done well with this webinar? What would you like to see in subsequent webinars? And we'll be more than happy to hear from you and read from you. But until we come your way again and next time, please keep quality and the quality conversations as something that is very, very dear to your heart, because it should be, knowing fully well that quality is everyone's business. We're rooting for you and we're rooting for all the new frameworks and strategies that you're going to implement in your hospitals going forward. Until we come your way again, I remain in Kiruka. Okere, thank you so much for joining us today and we will see you soon. Bye now.